Ovarian cysts pain. What is an ovarian cysts? In this video you will discover what is ovarian cysts, what are the causes and the symptoms, and what are the best treatments. These tips will serve you all your life. So, please stay to the end of this video. It's worth it. Ovarian cysts, an issue of concern. The ovary is the organ that is most prone to a number and variety of cysts in the body of a woman. The ovarian function of producing hormones and releasing eggs is directly related to the formation of cysts. Usually, they occur in the reproductive age of a woman, but they can occur in girls or women of any age. An ovarian cyst is a sac or pouch that develops in or on the ovary more often during ovulation. These contents are in the form of liquid, but they could be solid or a mixture of liquid and solid materials. Even though ovarian cysts are small, about the size of a pea or a kidney bean, they grow to the size of a softball or even larger. Large ovarian cysts are quite remarkable because the ovary itself is about the size of a walnut. Ovarian cysts are very common, and most of these results in changes in the normal function of ovary and not from new growths. Indications of an ovarian cyst. There are many kinds of ovarian cysts, and since their size and number also varies, they cause a variety of symptoms. Many cysts even do not cause any symptoms and can be discovered during a regular gynecological checkup. However, abdominal pain is the first indicator of an ovarian cyst, and if the cyst is large you may face pain or feeling of heaviness in the lower abdomen. These cysts can also bring lower abdominal pain during intercourse. Another possibility of such pain might be the stem that forms on some cysts and becomes twisted. That also stops the normal flow of blood and causes intense burns of pain. If a cyst ruptures, it can cause severe lower abdominal pain along with weakness, nausea, or vomiting. The cyst can also cause other symptoms and can press on the rectum, leading to constipation, or on the bladder, creating an urge to urinate. You should not ignore any of these symptoms, as they could also be the signs of a gastrointestinal disturbance or any bladder infection. Ovarian cysts can cause irregular periods in a condition called polycystic ovaries, whereby the hormonal system regulating the ovaries is disturbed and may cause to form a large number of cysts. Some women also face trouble in pregnancy. Two most common types of ovarian cysts. Ovarian cysts are fluid-filled sacs that grow on a woman's ovary. They are relatively widespread and usually harmless. Many women have no symptoms at all, and about 1/3 of menstruating women have an ovarian cyst at any given time. The two most common types of ovarian cysts are corpus luteum cyst. This type of cyst develops in the corpus luteum, which is the tissue that fills an empty follicle once it has released an egg during ovulation. These cysts may bleed and cause pain. Follicular cyst. These cysts form in a follicle where an egg develops during ovulation. Neither of these types of cyst usually cause symptoms and typically disappear on their own. Another type of ovarian cyst, a benign tumor, grows slowly and, in rare cases, may become cancerous. Women with a condition called polycystic ovary syndrome (PCOS) often have multiple follicular cysts. PCOS is a syndrome that causes hormone imbalances. Some women with PCOS do not ovulate or only ovulate rarely. Sometimes a cyst grows so large that it twists the ovary. This can damage the ovary or fallopian tube, or even cause life-threatening bleeding. This type of cyst requires immediate treatment to prevent permanent damage to the ovary. Sometimes, a surgeon may have to remove the ovary if it is too damaged. 8 home treatments. Unless a cyst is very large or growing rapidly, a doctor will usually advise watchful waiting. This means waiting to see if the cyst goes away without treatment. A doctor may perform several ultrasounds over a few months to monitor the cyst and ensure it disappears or does not grow larger. Home treatment cannot make the cyst disappear. Instead, the goal is to treat any symptoms and manage pain. For example, many women with ovarian cysts experience more significant pain during their periods, so home ovarian cyst treatment often focuses on managing period pain. Some of the most effective strategies include 1. Over-the-counter medication. Over-the-counter painkillers can provide relief from discomfort. Non-steroidal anti-inflammatory drugs (NSAIDs), such as ibuprofen, can treat the pain caused by ovarian cysts, as well as period cramps. Women who get no relief from NSAIDs should contact their doctor, since intense pain may point to a severe complication. In some cases, a doctor may prescribe different pain medications, such as co-codamol, which contains codeine. 2. Massage. The pain of an ovarian cyst can cause the surrounding muscles to tense up. This can be particularly uncomfortable during the period. Massaging the lower back, thighs, buttocks, and stomach can help loosen tense muscles and reduce pain. 3. Exercise and stretching. Exercise and stretching can also help ease pain linked to ovarian cysts. It can also help with muscle tension. Some women get relief from intense exercise such as running, while others prefer gentle stretching and yoga. Exercise can support healthy body weight in women with PCOS. Even without weight loss, exercise may reduce pain by strengthening the muscles. It may prevent the development of further cysts and help combat insulin resistance. 4. Heat. Heat increases blood flow, helping to reduce pain. Try applying a heating pad or hot water bottle wrapped in a towel to the stomach or lower back for about 20 minutes. It is safe to repeat this several times a day as long as the pad is not hot enough to burn skin. Do not sleep with a heating pad. 5. Relaxation techniques. Stress and anxiety can make the pain worse. Relaxation techniques, such as meditation, yoga, and deep breathing, may help relieve anxiety and reduce the intensity of the pain. These techniques can also help a person manage pain long-term and improve general health. 6. TENS device. Transcutaneous electronic nerve stimulation (TENS) delivers a tiny, safe electrical signal to the nerves. This signal can change how the nerves respond to pain, helping with both period and ovarian cyst pain. TENS devices are available over the counter, but a doctor may also prescribe one. 7. Weight loss. If a woman is overweight, losing weight may help her body better regulate hormones, prevent the development of more cysts, and improve symptoms of pain and fatigue. It is difficult to lose weight with PCOS, so try not to become disheartened, as it may take time. 8. Dietary changes. Many women with PCOS are insulin resistant. This can lead to diabetes, make pregnancy more difficult, and cause weight gain. A wide range of dietary changes may help, but as research does not point to a specific diet for PCOS, a woman may need to use trial and error to find what works best for her. As women with PCOS may have insulin resistance, it might be helpful to reduce sugar intake. Sugar is in a wide variety of foods, including carbohydrates such as bread and pasta. A doctor can check a person's blood to see if they are at risk of developing diabetes. Choosing to eat healthy whole foods will help a person get their weight within a healthy range. Other ways to treat ovarian cysts. Unless the cysts are growing or causing symptoms, medical treatment might not be necessary. Medical treatments for ovarian cysts include hormonal birth control pills to regulate the hormones and reduce the risk of developing more cysts. Metformin to increase insulin sensitivity in women with PCOS. Surgically removing the cyst, using a small incision in the navel or stomach. Removing the ovary or fallopian tube if the cyst has severely damaged these structures. A doctor may need to monitor a growing benign tumor regularly. Sometimes, a doctor may suggest removing the tumor even if it is non-cancerous or does not cause symptoms. When to see a doctor. Only a doctor can diagnose an ovarian cyst and determine if it is safe to treat it at home. Women who think they might have ovarian cysts or PCOS should see a gynecologist. They will ask about the woman's medical history and may perform an ultrasound or blood work. In rare cases, an ovarian cyst can become a medical emergency. A ruptured cyst can cause intense, unbearable pain and heavy bleeding. A woman with a ruptured cyst may also experience dizziness, nausea, or vomiting along with pelvic pain. If this occurs, they should call a doctor immediately or go to the hospital. Outlook. Ovarian cysts are common, and most are harmless and go away over time. Even when they persist, treatment is safe and reliable and can prevent the cysts from causing serious harm. Home treatment for ovarian cysts will not make the cysts go away but can ease any pain or discomfort. Women should be mindful of any changes in symptoms and should never ignore severe pelvic pain. With proper home management and medical care, an ovarian cyst may be a little more than a temporary inconvenience. Ovarian cysts pain and what you should do. A cyst is a little balloon filled with air or fluid on one of the ovaries, which then exerts pressure on the right or left side of the lower abdomen. These cysts can be painful. Besides the pain in the lower abdomen, some other symptoms are erratic, painful periods, often with much uterine bleeding as a result of elevated estrogen levels, painful intercourse, heel pain, and excessive hair growth. When the ovarian cyst bursts, the pain is relieved, though in some cases the cyst may reappear. The incidence of ovarian cysts is on the rise, particularly among women between 14 and 55. Let's look at some of the main factors that contribute to the development of cysts, and then the main things we can do to prevent them. Causes of ovarian cysts. Increased use of birth control pills, especially Depo-Provera. Increased consumption of hormone-infused foods such as most commercial meat and milk, to which growth hormone has been added. Stressful, frantic lifestyle. Imbalanced, not a natural diet. Obesity. A toxic, overburdened liver. How can we diminish the likelihood of ovarian cysts? Consume healthily, that is, organic meats and milk. Eat lots of fresh vegetables and drink abundant water. Use a natural progesterone hormone cream. Increase your liver metabolism and detoxify. Your allies here are the natural tinctures of olive leaf, dandelion, milk thistle seed, and artichoke. Check your thyroid. Stop smoking. Lose weight. When all is said and done though, it really comes down to a healthy lifestyle. This means to be true to yourself, not wishing yourself to be different. The hard part, oddly enough, may not be acts of heroism. Rather, it can be dropping parts of ourselves which are not worth holding on to, but we cling to from sheer habit. Your health is in your hands. So take excellent care of yourself, you are worth it. Thanks for watching. If you liked this video, please hit the subscribe button to receive more like it in the future. If you liked this video, share the love and give it a thumbs up.